Hello everyone, my name is Dr. Nitin Choda. I'm the CEO of InTouch Billing, also on the web at intouchbilling.com, and this video is part of the 2024 Private Practice Growth Roadmap. I'm going to focus on the 10 mistakes to avoid with benefit verifications and pre-authorizations, and we have to get this right as private practice owners, as private practices, because if there's a mistake here, the rest of what we do, the treatment, the documentation, the billing, the coding, none of that matters. If we get this wrong, we are not going to get paid. So let's dive right into the top 10 mistakes to avoid with benefit verifications and pre-authorizations. Let's start with mistake number 1, lack of due diligence before initiating the benefit verification or pre-authorization. Yep, you need to make sure that you're prepared even before you go ahead with the benefit verification. Make sure you watch this video all the way to the end because I'll be covering each of these 10 mistakes in more detail. Let's go to point number 2, incomplete data requested from the payer. Number 3, incomplete information obtained from the payer. Oftentimes the payer won't give you all the information, and you've got to really push and make sure you get the right information that you need. This is a critical mistake that most private practices and most billers make. Number 4, relying on online benefit verification portals on EMR systems to provide you with reliable and accurate benefit verification. I can tell you that you should not be relying on online benefit verifications because they never provide you with all the information you need. You might think, oh yeah, we're getting the job done, but the best way to get accurate benefit verification information is to verify those benefits over the phone. Mistake number 5 is working hard as opposed to working smart. If you don't approach benefit verification the right way, your staff is going to get overloaded. It's going to lead to low morale, and it's going to lead to decreased employee productivity, and that's going to lead to a chain reaction of poor productivity, declining reimbursements, and possibly even staff turnover in your practice. Yes, benefit verifications are a very high source of stress for private practices. And if you find it difficult and challenging, you're not alone, but we'll make sure we give you a solution by the end of this video. Number 6 is the absence of a documented process for benefit verifications. Yes, you need to have a precise and documented process for verifying benefits. Because if you don't have a plan, you're not going to get the exact information you need to be able to verify benefits successfully. Mistake number 7, and this is very important, is the inability to distinguish between junior and senior reps when you call insurance companies. You know the feeling. Sometimes when you call the payer, you know as soon as they pick up the phone that you're probably going to be wasting your time because they don't know what they're doing. There needs to be a way to identify which rep is giving you the right information, who's higher up in the food chain, if you will, and who can actually give you the data that you need to have an accurate representation of the patient's benefits so that you can provide the right treatment and get paid for your services. Oftentimes, a lot of practices come across junior reps who give them the wrong information, and this leads to a chain reaction of problems and claim denials. Number 8 is ambiguity between the ICD-10 codes and the CPT codes that need to be verified and that need to be authorized. Oftentimes, you'll get certain ICD-10 codes that are authorized or verified, and you'll get certain CPT codes that the payer says they'll pay for. But when you go to bill out those claims, you find that, whoops, we're not going to get paid for them. And by that time, it's too late. Weeks have gone by, in some cases, months have gone by, and you don't get paid. So we need to put an end to the ambiguity that exists with the ICD-10 codes and the CPT codes that get reimbursed. And you'll discover how to do that also by the end of this video. Mistake number 9 is the lack of HIPAA compliance. Now, I don't need to tell you how important this is. We are dealing with PHI. We're dealing with important patient health information, protected health information. So you need to make sure that none of the patient's information is essentially leaked or goes to any person outside of your clinic. Not having proper protocols leads to a violation of HIPAA protocols, which could put your practice at risk. And finally, the most important point, hiring just about anyone off the street to do benefit verification. Benefit verification is a very specialized and very important task for your private practice. Those who verify benefits are like the gatekeepers for your practice. They are like the shepherds for your practice. They are the protectors of your practice, because when done correctly, that allows you to get paid. When it's not done correctly, nothing else you do matters. Now, let's start with the first point, lack of due diligence before verifying benefits. I have to tell you, it's important for every practice to have a list of all the NPIs of the clinicians in the practice. That's number one. Number two, having the tax ID of the business. And number three, having a list of payers and all their phone numbers. The very first thing you should do before you verify any benefits is to make sure that your payers have all the NPIs in their system, they have the tax ID in their system, and that you're enrolled with them properly, whether you're in network or whether you're out of network. You've got to make sure that all of this information exists in the database of the insurance company, because if the insurance company has the wrong information for you, the wrong NPI, the wrong tax ID, and if they just haven't set you up in their system properly, then that's going to lead to a bunch of problems down the road. Also, another tip is that you should verify benefits on a regular basis. Don't just assume that because you verified the benefit once that is going to be okay. You need to verify the benefits often because patients' benefits can change from time to time. And by the way, I'll cover this in more detail later on in this video training, but online benefit verification is a tempting shortcut, but it is not the solution. Oftentimes it's counterproductive. Online benefit verification is often incomplete, sometimes it's outdated, and it doesn't give you the information that is current as far as a patient is concerned. Patients' benefits change, patients' plans change, and sometimes payers change their own internal guidelines, and there are times when their online benefit verification system doesn't keep up. So it's best to verify patient benefits over the phone, because then you're going to get accurate information and you can get a call reference number for every call that you make to the payers. Now let's get to the second point, which is incomplete data provided to the payer. Now, this is all the information that the payer needs to be able to verify benefits accurately over the phone. The first name of the patient, the last name of the patient, the date of birth, the patient's address, the patient's phone number, the payer's name, the patient's insurance ID, the payer's group number, the list of ICD-10 codes and the CPT codes where you want to verify the patient's benefits. You need to verify that the policy number and the group number that was provided by the patient are indeed 100% accurate. Oftentimes the patient give you this information, but it may not be accurate. The effective dates of the policy, in other words, when the policy started, when it's going to end, and the current status of the policy. You want to make sure the policy is active. The types of policy and the services that are covered, because some payer plans cover certain services and others don't. You can't assume that your services will be covered by the policy of the patient. You've got to verify the co-insurances and the co-pays. You've got to verify what the deductibles are and how much of the deductible has already been utilized by the patient in that current calendar year. You've got to verify the policy limitations. What are the limitations of the policy? If you're a therapist, a physical therapist, you need to verify whether the therapy cap has been met or not been met by the patient. You've got to find out if there are any exclusions to the policy. Is there some fine print somewhere that would prevent you from billing out what you want to bill out to the patient? Now, this is an important one. If you ever have to mail a paper claim, a physical claim as opposed to an electronic claim to the payer, what is the payer's mailing address and what's their fax number? You've got to be able to verify what their mailing address is and their fax number in case you need to choose that route, that path, to be able to send them the claim. You've got to ask about the claims adjuster's name and phone number. You can actually get this information when you're verifying benefits. What is the name and phone number of the claims adjuster? You should ask whether there's a requirement for pre-authorizations or referrals, because then in that case, you need to be able to get a pre-authorization as well. Now, in case you need to get a pre-authorization, you need to get a pre-authorization number. You need to get an effective date for the pre-authorization. When does a pre-authorization expire? Is it limited to a certain number of visits? Is it limited to a certain number of ICD-10 codes? Is it limited to a certain number of CPT codes? What are the exclusions? What are the limitations of that pre-authorization? Let's recap that. Pre-authorization number, authorization start date, authorization end date, number of visits approved, number of visits already used, and any approved CPT codes. If the patient is in network, what are the in-network benefits? If the patient is out of network, what are the patient's out-of-network benefits? Are there any timely filing limits for claim filing? Yes, you can get this information while verifying benefits as well. What are the specific documentation requirements? Often payers change their documentation requirements. Sometimes they require you to submit documentation. Sometimes they want to see specific things in the documentation, and you can actually get that information from them over the phone if you know the right question to ask. And finally, this is the most important thing when you're verifying benefits over the phone. Get the name of the rep, get the date and time of the call, and get a call reference number. Because if you get denied based on the information that the rep has given you, you have every right to contest that and get paid by insurance companies. And that's what we have done at InTouch Billing. Mistake number 4. Relying on online benefit verification systems. A lot of EMR companies will try and sell you on the fact that you can do benefit verification online. It's very tempting, it's kind of cool. But the fact is, online benefit verification is simply not reliable. Now remember, EMR companies are simply trying to sell you stuff. They won't tell you that phone reps, when you contact payers and when you speak with a rep over the phone, have as much as 3 times more information. They have information that their online systems simply don't have because they have access to a different database. Online benefit verification can work at times, but in general, it is not as reliable as getting your benefit verification information over the phone with a representative from the insurance company and getting a call reference number and getting all the data points. In fact, let me show you all the data points that I referred to a couple of minutes ago in this video on your screen right now. Take a look at all of these data points. It is not possible. It is simply not possible to get all of these data points that you're seeing on the screen right now from an online benefit verification system, from an online portal. It is simply not possible. And right there, I rest my case. So again, all of these data points that you see on your screen right now, you can only get when you call an insurance company, when you speak with a rep, when you ask the right questions, and then that's how you get all of this information over the phone. The best way to do benefit verification is to call the insurance companies, have a plan, ask the right questions, know when you're getting the right answers, because sometimes, and this comes with experience, the insurance company rep might give you an answer, but you know that that doesn't quite make sense, and then you have to call again or speak with another rep, and always get a call reference number. And I want to emphasize again that you really need to do this right. Not having accurate benefit verification information, not having the correct pre-authorization is the number one reason for claim denials. We know this because at InTouch Billing, we've billed out hundreds of thousands of claims and we've collected tens of millions of dollars for our clients. And I can tell you that this single mistake can lead to a chain reaction. It's very tempting to click a few buttons in a portal, in an EMR system, and then get the benefit verifications, but that is not the best way to do it. In fact, oftentimes it can be counterproductive and it can backfire on you. We've done this for a long time, and I can tell you that in our experience, the most common reasons for denials include the therapy cap has been met, the policy is no longer active, the mailing address for the payer was incorrect. Just reasons you wouldn't normally even think of. A couple of other reasons for claim denials: denied authorization. You got the authorization, you thought it was okay, but as it turns out, there was something wrong with the authorization, or the authorization got denied. And other reasons include benefits simply not included in the patient's plan. Remember, different patients have different plans with the same payer. So it's quite possible the payer may cover some treatment for certain plans, but may not cover that treatment for other plans. And that really is where the nuance comes in, where the experience comes in, where you need to get benefit verification right. At InTouch Billing, you get a comprehensive solution, not just for benefit verification, but for claims submission, for denial management, for managing your accounts receivable, for payment posting, for patient payments, for patient statement mailing. It is a one-stop shop. InTouch Billing is a one-stop shop for all your billing needs as a private practice, as a healthcare organization. You no longer need to have your staff be on the phone for 30 to 45 minutes, get the wrong information, waste their time, and then again call the insurance company, and then again not being sure that you get the right information. Let us handle benefit verifications for you in addition to your billing service, which now leads me to point number 5. If the benefit verifications are not done correctly, it can lead to reduced staff morale. It can lead to a crippling, a destruction of employee productivity, and it can result in an overall decrease in your staff's morale and an impact to the bottom line of your clinic. In fact, there can be tens of thousands of dollars, potentially hundreds of thousands of dollars in lost revenue for your clinic. Let me give you an example. Let's say you pay your staff member $15 an hour. And let's say your staff member spends about 30 minutes on the phone with an insurance company verifying benefits. They now spend another 10 to 15 minutes putting that information into your EMR system. So by the time all the work is done, you've actually spent right around $15 to $20 to get the benefit verified and inserted into your EMR system. Even then, the information might be incorrect. And let's say a clinician does 12 visits with a patient and all of those 12 visits get denied. We're talking several hundred, potentially several $1,000s in lost revenue. And when this happens, it hurts the clinic. It not only hurts the bottom line, it hurts staff productivity and it hurts staff morale. Now I'll go to mistake number 6, which is the absence of a documented process. Every step of the benefit verification process, every step of the pre-authorization process must be documented. Your staff should know whom to call. What's the right department? Are there specific phone numbers not only for different payers, but what are the specific phone numbers for different departments within the payer's company? For example, Aetna, Cigna, United, Blue Cross, they all have different departments and you need to be able to speak with the right department. Do you have the right contact information for the payer? Are you verifying the benefits as soon as a patient requests the benefit? Let's say Susie calls your practice on a Monday and says, "Do you accept my insurance?" How quickly can you turn that around and get that information over to Susie so that she can make a decision to come into your practice? Do you even accept same-day patients? Some practices don't accept same-day patients. They need the patients to call and schedule an appointment at least a day or two in advance. And this process, this policy actually gives the clinic enough time to verify the benefits and to do a good job by doing it accurately. Now, when it comes to pre-authorizations, you need to have access to all the different payer portals, the payers' websites. You need to be able to access the websites, upload the information necessary to get the authorization. You need to know which link you have to go to, what the credentials are, what is it that the payer requires. Do they require you to upload a copy of the documentation? Do they require you to upload additional information about the patient? You've got to have a documented process for every single thing. All the payers' phone numbers, all the payers' websites, what each individual payer needs. You've also got to document when it's time to get a new benefit verification, when it's time to get a new authorization or a new certification. So all of these things have to be documented. If you don't have these processes documented, reach out to us at intouchbilling.com, schedule a call with us, and we'll walk you through some of these processes and try to help you in any way we can, and also tell you a little bit about what we do for you. Now, here's another related point. The patient also plays an important role in this. You've got to notify the patients to call the payers to verify their coordination of benefits. A lot of payers are actually requiring the patients to do this more than once a year. It used to be once a year, but now it may be necessary to ask your patient to verify their coordination of benefits by calling the payer. So this is another thing that you have to keep in mind. Only the patient, only the member can do this. You as a provider simply cannot do this. Speaking of patients and their plans, make sure the patient's plan is actually included in your contract with the payer, in your contract with the network. You may be contracted with the payer, but that doesn't necessarily mean that you can accept the patient's plan, because the patient may have a plan that is outside your network contract. And while we are on the subject of commercial plans and different payers, different plans, with Medicare and Medicaid, you need to verify whether the patient has direct, straight Medicare or Medicaid, or whether they're part of an MCO, a managed care organization. You've got to ask the patient about this as well, because that impacts the benefits of the patient. That impacts how often you need to verify benefits and when you need to get the authorization. And the problem is, you might think that you're in network, but you may not be in network with that particular managed care organization. So you want to be really careful about that and verify benefits and get pre-authorizations as needed and make sure you're on top of that. Now, mistake number 7 is actually a mistake from the payer side and not from our side. the payers often have inexperienced reps who are not trained properly, reps who actually accidentally, inadvertently give you the wrong information. Unfortunately, if a rep makes a mistake, that can lead to a chain reaction of problems for you. And so the inability to differentiate between junior reps and senior reps is a big problem. How do you know whether they're giving you the right information or not? A lot of it comes with experience, a lot of it comes with tracking your data, having a general protocol, knowing that this plan is likely to cover these ICD-10 codes, these CPT codes, and when you get the wrong information or information that doesn't make sense from the rep, you know you're not on the right track. At InTouch Billing, we make hundreds of thousands of phone calls every month on behalf of our clients to verify benefits. And as soon as a rep picks up the phone, we know whether we're speaking with someone who knows what they're talking about or who's new on the job. So what do? We ask a series of very probing questions and very specific questions. I've actually provided you with a list of all of those questions and all of those data points earlier in this video. In fact, let me put up a list of all the data points we ask every single payer rep on the screen right now. So you'll see these are the data points that we ask every single rep of every single payer when we call them. And if the rep is not able to give us the information or the rep doesn't understand what we're talking about, we ask a series of probing questions. And once we're convinced that, hey, this is probably not the best use of our time, we ask to speak with the supervisor. And if that doesn't go anywhere, I have to be honest with you, we just hang up and we call again and we try to get a rep who can then give us the right information. So the inability to distinguish between junior reps and senior reps, as strange as it sounds, is one of the biggest mistakes that are made with benefit verification. Mistake number 8, ambiguity between the ICD-10 codes and the CPT codes that need to be authorized. Now, the ICD-10 codes are highly specific, and also there are certain nuances between different CPT codes. Understanding the specifics of each ICD-10 code, understanding what every single CPT code is intended, what situation it's intended for, what are the specific components that constitute the necessity behind that particular treatment. That is really important because then you can ask the right questions, then you can identify what's covered, what's not covered, and make sure you provide the patient with a service that is not only medically necessary, but that's also covered. So understanding the ICD-10 codes, the CPT codes, because there are certain nuances where you might think an ICD-10 code is covered or a CPT is covered, but it's not, or there are certain limitations, or there are certain modifiers that need to be in place along with those ICD-10 codes, with those CPT codes for you to get paid successfully. All of these nuances should be the domain of the biller. So your biller should know what he or she is doing in order to get you paid successfully. And that's where benefit verification and billing tend to blend in. At InTouch Billing, we have an experienced team of billers and coders, over 200 billers and coders working in our company who are part of an army, an arsenal, if you will, of billers and coders that is available at your disposal to make sure that you get paid every dollar that's due to you. Your reimbursement is maximized by the team at InTouch Billing. Mistake number 9, lack of HIPAA compliance, a HIPAA violation, the exposure of the patient's protected health information. If you're calling to verify patient benefits, make sure no one can hear you. Make sure you don't have post-it notes or sticky notes or the patient's information just lying around on your desk. That is a violation of the patient's privacy. Avoid Word documents on your computer that have the patient's information. Avoid submitting the patient's information to online payer portals if those computers are accessible by other staff members. Do not email patient information to another staff member using a generic Gmail or a Yahoo account or an AOL account, because those accounts are not HIPAA compliant. Those accounts are not end-to-end encrypted, which means a hacker can easily access those accounts and get all the patient information. Remember, a single mistake can expose your practice to liability and potentially put you out of business. Now, let's go to point number 10, hiring just about anyone off the street to do benefit verifications and authorizations. This is a specialized task. You need a biller or a coder who knows what to ask the insurance companies, who knows when to probe, who knows when to detect when the information doesn't make sense, and you need someone who's organized, who's methodical, who can document the information and connect the dots between benefit verification on one end and between the claim submission on the other end to make sure that everything is lined up and that you get paid. You cannot have benefit verification be the weak link in your practice. It would be like hiring a teenager to guard your house when you're trying to protect your house. Benefit verification is the beginning and the most important part of the claim creation and the claim submission and the reimbursement process. At InTouch Billing, all our billers and coders are AAPC certified, the American Academy of Professional Coders. We all undergo regular training. We are compliant with all of the payers' guidelines. We keep up with all the changing regulations, and we make sure that you don't have to worry about any of this. A single mistake with benefit verification can not only result in tens of thousands of dollars in lost revenue, but can also expose you to liability and can lead to HIPAA violations, which have the potential to put you out of business. So those were the 10 mistakes with benefit verifications and pre-authorizations. I hope that this was helpful. Please reach out to us at InTouch Billing, and our email is support@intouchbilling.com. Our phone number is 1-800-421-8442. Feel free to give us a call and ask us any questions you have. In fact, visit our website, check out what we can do for you, and schedule a call to learn more about what InTouch Billing can do for you. We handle benefit verifications, we handle your pre-authorizations, we review your documentation, we submit claims, we post payments, we fight denials. We fight denials on your behalf, and we make sure the insurance companies are held accountable for every dollar that's owed to you. I can tell you that the insurance companies have met their match with InTouch Billing. Thank you so much for watching. This video is part of the 2024 Private Practice Growth Roadmap series, and you'll see the Private Practice Growth Roadmap on your screen right now. Make sure to download this roadmap, and you'll find the link to the roadmap below this video. Thank you so much for watching, and we look forward to seeing you in the next video training here at intouchbilling.com. Thank you.